Hi, my name's Dane Lytle. Me and my wife started trying to have a baby in early 2000. We ended up figuring out that we had some infertility issues in 2003. In 2000, we then tried several different rounds of IV or of insemination and some other techniques. We decided that IVF was not a choice we wanted to do. So in 2013, we decided to embrace not having quote unquote children in a normal way. We, had a lot of struggles during those 10 years. Both my wife struggling with not being able to have a child and me struggling with not being able to give her a child. We both had issues with our fertility, so it was both of us that made it to where we couldn't have kids. It was hard. It was very hard to go through all those discussions and arguments and problems and work through all those. We've now been married for 21 years, so it wasn't an easy process to get through that. That was early in our marriage, and we had to struggle through that and struggle through our marriage with that. It's hard for a guy, as for a woman, it's her not being a mom. So it's a pretty clear cut case of, I can't do this and I'm born to do this. And so it's a real struggle for a woman. It was a real struggle for my wife. For a man, it's different. We want to have kids. We want that in our life. I love kids. I love being around them. I love spoiling them. I love spending time with them. I love watching them develop and become better people. But for a guy, it's just different. That it was a little easier for me to accept not having a kid myself because I was able to still do those things for others. But yet, there are times even now where it's a struggle, and I think, well, shoot, you know, I like working hard, and that's part of who I am. And because of that, I'm going to have things that I can pass on to somebody, and I don't have that person necessarily to pass on to. And so those are struggles that, as a guy, you're like, shoot, what do I do? And I've got nieces that we're very close to and that we spoil rotten, but it's just not quite the same. We've got a foreign exchange student, Bruna, that lived with us for quite some time, and we've stayed very close to since. And I call her my daughter. And we've had those very close relationships, but again, it's still different. She's got parents in Brazil. And so it's just, you have to learn to adjust and redefine your life to what those expectations are and how you can move forward with those. You have to consider different things in your life and plan differently. Um, but the flip side of that is because we haven't had kids, we've got lots of freedom. We get to travel a lot. When I watch friends of mine that have kids that can't do that, we normally, in most cases, have more money than our friends with kids because they spend so much on their kids. We, have the ability to drop things at the last minute and do things if we need to. And a lot of people with kids don't have that ability. You've got to have somebody to take care of the kids. So there's positives and negatives. It's, again, very different for a guy. But it's no less, I don't think, a struggle. It did have to be me that said, I don't want to do this anymore. I don't want to try this anymore. I don't want to. So I had to be strong for my wife and say, even though I probably did want to try it to an extent, And I didn't want to give up on the idea of having a kid. There came a point where it was hard to keep doing that when we weren't seeing any results. When we talked to doctors, all they could say is, "Yeah, you can try, spend $10,000 on IVF, and maybe it'll work." I doubt it, but maybe it'll work. And that just didn't make sense. It wasn't logical for us to do that. If a doctor thought that there was a good chance that that was a possibility and that we might see positive results from that, it may have been a different story. Um, Everybody always asks, why didn't we adopt? Um, that's a hard one. I would have totally considered adopting it, but it was. It's not as simple as people make it out to be. We've had a bunch of friends that have adopted, and the end result hasn't been positive for them. We had one friend that they had one baby taken away. The second baby that they adopted died at birth. And finally, the third baby they adopted, they did get to keep, but he has TB. And so they've got to deal with that for the rest of their life. I just can't imagine how my wife would have handled somebody letting us adopt their kid and having them come back and take them back from us. We'd already been through so much, accepting the fact that we couldn't have our own kids. And I just didn't see that either one of us would have handled that very well. And so we talked about it a lot, but I just didn't feel like it was the wisest thing for us to do because it wasn't just one friend that had those problems. We had heard that from 3 or 4 different ones. And so we just decided that that wasn't, best for us. But it was a hard decision because it was an option. Um, there's also no guarantee that you're going to get to adopt. Um, and that can be hard. It's a lot easier if you're willing to foster, but again, I was worried that we'd foster a kid that'd go back to their parents. We neither one would handle that very well, especially if they were going back to what we thought was a worse situation. So, I mean, that's pretty much, my side of the story and what I feel defines what my struggles were when we went through. A lot of my struggles were my wife's struggles. It was very early on in the process. When we found out that we were struggling, we went, my wife had several tests done first because that's where they go first, and found out that she had endometriosis really bad and that there were some other issues. But at the same time, they went ahead and tested my sperm. We found out that it had low motility and that the shape of them weren't perfect. We don't really know why. They, of course, immediately put me on certain vitamins and, restricted diets and certain things, tell you to go exercise more, which I already was. Tell you to just start eating better, which we did. But we continued to test those results as we went along. They didn't get better. I was in a car accident when I was younger, and I hit my head pretty hard. And we believe, just based on different, trying to think of positive, negatives, why it or how it would have happened, that is what we can best hone in on, is maybe the reason, because my pituitary isn't working properly. I have low testosterone also because of it. And so we believe that that may be the problem. But it was very early that we knew that mine was an issue and that we could, but with insemination, with IVF, with those things, they can take one or two of my good guys and could have probably gotten around that had it just been me. But us just working together, it did absolutely affect our result. Um, and ultimately, they do their best to put one or two of those good guys in there, but it still could potentially be something wrong with those one or two good guys that they don't know. So it is definitely a factor, and definitely was one of the main reasons we didn't have a baby. So I think the biggest thing that is misinterpreted, I'll talk to people. I'm in a business where I'm around a lot of people a lot. And I'll mention that we can't have kids. Well, it's just all of a sudden there's an interpretation that maybe we just didn't want them. We chose not to have them. There's a kind of a stigma that maybe we were selfish and didn't. So as a guy, it's almost like, if a woman doesn't have kids, sometimes they pretty much almost always go to there was something wrong, and they couldn't have kids for some reason. But when a guy says that they don't have kids for a reason, oftentimes it seems like people go to that I made that choice to not have them, and they don't even recognize the fact that there may be a reason why I don't have them. So it I think that's the thing that bothers me the most is like, if I had had the choice, I would have. I love kids just like my dad did. And um, I love my nieces, and I love Brenda, and I love all these wonderful kids, my nephew Connor, and I love being with him. So there's no way I wouldn't have chose to do that had it been within my control.
Hi, my name is Erik. I'm from Los Angeles, California, and I'm going to tell a little bit about my journey with male infertility. So, um, my backstory is that my wife and I um, decided to start a family when we got married. And well, let me give a little bit more of the backstory. So, to be to be 100% technical, I actually had a child in a previous relationship with my current wife, and unfortunately, my daughter from that relationship passed away. She was born with a lot of uh, special needs. She was had a brain malformation. It's kind of a long, drawn out story. It's very dramatic, very traumatic. But having gone through that experience, I met my wife. We got into a relationship, and then at that time we made the decision to start a family with the two of us. And at that time we did what the normal thing was, which was to try to have a family the natural way. And after a while that didn't work, and she went to the doctor, she got checked out, everything seemed fine. I went to the doctor, everything seemed fine with me, but um one of the things that we realized was that the volume, I'm going to get technical, sorry, but the volume of semen was not as much as it should be. The semen was, this is when I did a test. The the semen were fine. Everything was swimming and healthy. The sperm was healthy, but there was not a lot of volume. So what happened was they sent me to a urologist. The urologist did what's called an ultrasound, and he looked down there and he said that what he saw was that I had a blockage in the seminal vesicle. And technically, the seminal vesicle is what brings volume to semen. Your sperm comes from your testicles. Your seminal vesicle brings the rest of those fluids in there. He said I had a blockage. He said it was probably, he could fix it very easily. Just go in for a minor outpatient procedure. I was going to have the procedure on a Thursday. He said it would be done. He said you should be back to normal by Saturday. Long story short, that surgery turned into a nightmare. I felt horrible the moment I woke up. I was having all kinds of pains and discomforts and fevers and things like that. And I would say for about 2 weeks after the surgery. I never felt right. Just kept getting sicker and sicker and sicker. Eventually, what happened was I went to the emergency room because I just never got right. And they diagnosed me with what's called a perforated bowel. So your bowel is, where it's actually your large intestine, is some people call it your bowel, the end of it. So I had a perforation, and it definitely came from that surgery some kind of way. The treatment for a perforated bowel, believe it or not, is a colostomy, which means they take a part of your intestine, pull it through your stomach, and so you have like a little thing sticking out of your stomach, and that's where you move your waste, your solid waste. I had to have that thing for a year. Thankfully, after a year, they did what was called a reversal surgery. Everything went back to normal. Now I can, thank God, use the restroom like I don't like to use the word normal because who is normal, but my function is back the way it was before. But that's all part of my infertility story because I ended up in the hospital for 25 days. I had to have a colostomy bag for a year. And so then after that, we tried again. And to this day, I still don't know if that surgery was successful because 2 weeks after the surgery, I was in the hospital. And, at that point, what happened with that original surgery and whether it was successful wasn't really important anymore because I was like fighting for my life. I almost died. Like I was septic. That's technically what happened to me. I was septic because of some infection. So after that, we tried. Didn't work. And we did a total of 3 rounds of IVF, and we never got pregnant, my wife and I. She never got pregnant. And, there's clearly an issue for me with the semen volume. I'm not sure if it was, what was going on her. And she seemed like she was fine, but technically they said that our diagnosis was I think it's called undiagnosed infertility. So I don't really understand. I mean, I know that it's true, but this whole idea that somehow you're not a man if you can't produce children or you can't get your wife pregnant or that has something to do with your manhood. I just think we should sort of get over that because it's really just a biological thing. It's like having any other thing that's wrong with you. Maybe you might have heart disease. Maybe you might have, I don't know, anything. There's lots of things that happen to human beings in their bodies, and it doesn't make you more or less of a man or a woman. And so I understand that there's a stigma associated with it, but like, I don't know, for me, the notion that somehow I'm less of a man because of infertility is just, it's kind of so preposterous to me that it doesn't quite really bother me when somebody would say something like that to me because it doesn't make any sense. So after a little while after we did our 3rd round of IVF that was unsuccessful, my wife and I, we were really kind of lost and we didn't really know where to turn because one of the things that I talk about is they always say that IVF and fertility treatments have like a 20% success rate, but you never hear the stories of the people who weren't successful. All you hear about is these happy ending stories. So long story short, my wife and I decided to do a podcast, and the reason we did the podcast was literally to reach out there and see if there was anybody else who was going through what we were going through. And so over the years, I think we're in our 4th year of doing it, living child free with Erik and Melissa. And we've been doing it for a while. It's been great. We've been reaching out to a lot of people. A lot of people reach out to us. It helps us feel more normal. And we hope that our stories and sharing other people's stories makes other people feel more normal because, infertility is rough. It's hard. It's devastating. It's life altering for all of us. And I think we need each other to, support one another.
My name is Richard Jake Fantus. So, what is male infertility? Well, male infertility is really the same thing as female infertility. It's basically a couple issue. It's defined as the inability to conceive after 12 months of appropriately timed unprotected intercourse. I suppose in a little bit more nuanced sense, specifically male infertility is the inability to adequately produce or deposit an adequate number of functioning sperm that would be required for conception. There are many causes of this. Some are inherited, genetic diseases like Klinefelter's syndrome, and others are due to different environmental exposures ranging from chemotherapy to variations in body temperature. It is actually a surprisingly common condition. While we expect about 15% of couples to be affected by infertility, which translates, into all couples worldwide, about 50% of um, couples will have some male component. What that means is that about 30-ish percent of couples have a solely male component, and 20% have some combined of either both a male and female component. So there are lots of myths about male infertility. I think one of the most common myths is that impotence equals infertility, which is clearly not the case. Uh, Erections are part of the sexual response cycle, and to have a child by natural means, of course, they're required. But at the same time, they have nothing to do with the production of healthy sperm. And while some of these causes can be overlapping due to problems like a low level of testosterone, a lot of times they're completely independent of one another. So again, to clarify, erectile dysfunction or impotence doesn't necessarily mean somebody has infertility. I think something a little bit more important is that infertility is not an isolated problem. And what I mean by that is a lot of people who have infertility think that that's the only potential issue that can come from it. And I think it's important that we know now that there's an association between infertility and other comorbidities, and even in some cases, premature mortality. That just means that men with infertility should make sure that they are plugged into the healthcare system or getting regularly screened by their primary care physicians, as there have been few epidemiological surveys to show that these men are at higher risk of developing other medical problems. Kind of along the line of the first point with regards to erectile dysfunction or impotence, there's a common misconception that more testosterone helps sperm production. And while you need an adequate amount of testosterone for sperm production, too much in the form of exogenous or testosterone administered to patients can actually hurt sperm production. So, shots, gels, or any other way of getting testosterone that are not naturally produced by your testicles actually tells your testicles to stop producing testosterone, which can in turn tell your body to stop producing sperm. So, it's very important for men who do have low levels of testosterone to get the correct form of replacement by seeing a reproductive urologist. I think one of the final things is that, we talk a lot about female lifestyle changes for fertility, and that some men think that their lifestyle doesn't necessarily impact their sperm quality or function or their chances of getting pregnant. And I can tell you that's not true. Now, I will tell you the evidence isn't as robust, but smoking and excessive alcohol consumption have been shown in conjunction to decrease sperm counts. Things like use of other illicit substances have been shown to decrease sperm counts. Even things like hot baths and really hot tubs have been shown to decrease sperm count. So there are a variety of things men can do to help optimize their fertility. Explaining unexplained male infertility, well, that's really challenging. I wish I could explain unexplained infertility, but I think one of the most frustrating things about this field is that we don't have a specific explanation for why some men have fertility issues. There are common reasons in terms of hormonal abnormalities and, surgical reasons that they may have dilated veins, increasing temperature, and there are even genetic reasons that we've discovered. However, I'd say that there are still a substantial number of men who have what we call idiopathic or unexplained infertility. I am hopeful that ongoing research into different genetic explanations of why people have infertility and research looking at different environmental factors and chemicals that could be associated with infertility will reveal some causes in the near future. But likely it's going to be a while before we're able to truly give reasons to why people have unexplained male infertility. Regardless of the etiology, though, some forms are, again, curable through hormone alterations and surgical correction, and some will hopefully be curable in the future when we have further research in the area. So to talk a little bit more azospermia. Azospermia means there's no sperm in a man's ejaculate, but it's important to discriminate that they do have an ejaculate, but there are no sperm in that ejaculate. Azospermia affects about 1% of the population, or about 200,000 people in the United States, and up to 15% of men with infertility. Azospermia has a variety of causes. Some of them are caused by blockages, which we deem obstructive azospermia, meaning there is a block where the sperm can't get from the testicles to out of the ejaculate. And a lot of times there isn't a blockage, and we call that non-obstructive azospermia. And what that means is there's an issue actually producing sperm. Now, there is, not a one-size-fits-all cure for some of these things, as it's important to understand the cause of the azospermia. But in men where we cannot find a cause from a genetic standpoint or environmental standpoint, and we know that they don't have an obstruction based on some laboratory values as well as their testis size, the chance of finding sperm in an azospermic man's testicle is still about 50%. So just because there's not sperm in the ejaculate does not mean that that man can't achieve paternity with his own sperm. Well, I think there are two large messages I have in regards to what I wish society understood about male infertility. First, it's far more common than we think it is. If about 50% of couples, again, 15% of all couples dealing with infertility, but 50% of them have some male component, that makes it an incredibly common disease. And I say that because I think often men feel alone when they have some issues with regards to their reproduction, and they shouldn't. There are great networks. The Resolve Network has many support groups that men can go to get help, to talk to other men that are in a similar situation, and I would highly encourage that. And the second thing I mentioned earlier is that there is an association between comorbidities and early mortality in men with infertility. And it's important that men with infertility make sure that they stay plugged in with their primary doctor to get yearly evaluations. Although I'd recommend that for everybody, I think it's especially important in this group.